Good morning. I will be giving a bedside SPA report on my patient, initials DLR, a 74-year-old female currently admitted in room number 11223. She's a four-code with no known drug allergies. She was admitted on 18th January 2026 and after experiencing a ground level fall at home. The patient reported that she missed the final step of her stairs and fell, hitting the posterior part of her head. She did not lose consciousness and she remembers the entire way. At the time of admission, her Glasgow Coma scale was 15 and it indicated that she was allergic oriented. Following the fall, she was diagnosed with a right closed femur intertrochanteric fracture. She underwent surgical repair with intramedullary nailing and open reduction internal fixation of the right femur on January 19th, 2026. Currently, the patient is stable but recovering from surgery, and her primary concerns about post-operative concerns are post-operative pain, decreased mobility, and prevention of complications such as infection, blood clots, and falls. Her pain is primarily located in the right upper leg at the surgical site. Today her pain score was 8 out of 10 at 8 o'clock, but it decreases to 5 out of 10 at noon. The patient says the pain is on the surgical side. It's sore and it's discomforting. Overall, she's stable but still requires close monitoring due to her age and surgical recovery and her underlying medical condition like she's diabetic. Background: the patient's past medical history includes diabetic mellitus 2, hypertension, CAT, prior left femur fixation, and percutaneous coronary intervention with drug-eluting stent replacement. These conditions are very important because she has a surgery and she has an increased risk of cardiovascular complication, impaired circulation, and delayed wound healing following the surgery. Regarding her social history, the patient is married. She's a Caucasian female, lives at home with her husband. It's a single level home with two steps at the entrance. Her husband has been present at the bedside and he's been very supportive during her hospitalization. She also has one son and one daughter. The patient denies any smoking, alcohol, substance abuse, and which is beneficial for recovery and long-term health outcomes. When the fall occurred, she developed a hematoma on the back of her head and shortening of the right leg, which indicated a fracture. Which is initially they gave fentanyl for pain, which caused nausea, vomiting, and then they treated it with the Zofran 4 mg and relieved the symptoms. Currently, she's on medication like acetone, oxycodone for pain, Tylenol for pain, enoxaparin for the blood clot prevention, insulin, Lespro and gargling for diabetes management, metoprolol, lisinopril, and PRN, labetalol for blood pressure control, atorvastatin for cholesterol management, and aspirin for coronary artery disease prevention. Assessment. So her vital sign in the morning at 8 o'clock, her temperature was 98, heart rate 93, blood pressure 156 by 81, respiration rate was 17, and oxygen saturation was 96% on room air. At 12, her vitals were like 97.7 Fahrenheit, heart rate 79, blood pressure 180 over 74, respiration 17, and oxygen saturation 93 percentage on room air. That's why, because her blood pressure was very high, we gave her PRN labetalol for blood pressure management at noon. At 4, her temperature was 99, heart rate was 93, blood pressure came down to 162 by 72, and respiration rate was 60, and oxygen saturation was 95% on room air. Neurologically, her Glasgow Coma scale is 14. She's alert and oriented times 4, but she's mildly confused at times, and that's maybe they said that it's because of the opioid for pain medication that makes her disoriented. So that's what they're thinking. She might have delirium, but it's not. She does not have delirium right now. Her pupils are equal round, reactive to light accommodation, brisk and to response. She demonstrated normal sensation in all extremities with strong and equal upper extremity strength, both bilateral. However, her right lower extremity is weaker than the left, which is expected because she had a femur surgery. No facial drooping or neurological defects were noted. So just her right lower extremity is weaker because she had a fracture on the right upper hip. Respiratory assessment. Moving on the respiratory assessment, the patient has clear lung sounds in all lobes bilaterally, respiration regular and unlabored. She currently is on room air. Her oxygen saturation is between 94 to 96. She has no coughs, no secretions, or no signs of respiratory distress, and the chest expansion is symmetrical. Cardiovascularly, she has normal S1, S2 heart sounds were heard. Brachial pulse was 93 beats per minute, and gap reflow was less than 3 seconds. Peripheral pulses on both feet are +2 bilaterally. There is a +1 edema present in the right lower extremity, which is related to the recent surgery and inflammation. Because of a limited mobility after surgery, the patient is at the risk of DVTs, which is why we are having preventive interventions are in place, and that are like prophylactic exoheparin. GI wise, patient's abdomen is soft, non-distendable, bowel sounds are present in 4 quadrants. Her blood glucose today was 91 at 7:40 in the morning, and at 1:10 at noon, her blood pressure, her blood sugar was in control, and her last bowel movement was prior to the admission for surgery. Genital urinary assessment. She's right now incontinent of urine, and that's why she's wearing a brief. Her urine is clear yellow, no foul odor or sediment. She does not have a follicle catheter at this point. Musculoskeletal assessment. She has generalized weakness with a slow and steady gait. The right lower extremity has demonstrate decreased dorsiflexion and plantarflexion strength, which is consistent with her recent surgery. A walking walker is available at the bedside, and patient requires assistance for ambulation. Skin and surgical wound. Skin assessment shows skin is warm, dry, intact, and normal texture. She has a surgical incision on the proximal anterior right thigh, which is currently clean, dry and intact under a dressing. However, the patient has been picking on the incision side, which increases her risk for infection. Her Braden scale is 19, that indicates a low risk of pressure injury. Lab findings results includes RBCs has been decreased since surgery, 4.36 to 3.46. Hemoglobin also decreased 12.8 to 10.4. Hematocrit rates decreased from 38 to 30. This decrease is basically because of the blood loss due to surgery, from surgery. Her white blood cells has gone down from 11.20 to 9.21. Which is within normal range, and it shows that currently she has no infection. Her blood glucose has improved from 213 at the time of admission to 89 currently, which shows that the blood diabetes is in control. Kidney function 1 has increased from 21 to 27, while creatinine improved from 1.15 to 0.67. Okay, so as per recommendation. So finally, we have to discuss the plan of care and the nursing priorities for this patient. The first priority is prevention of infection at the surgical site. Nursing interventions include sterile technique during the wound care, monitoring the incision site for redness and drainage, and keep the site clean and dry, and encourage proper hand hygiene, and monitor vital signs and laboratory results for signs of infection. The second priority is prevention of blood clots due to immobility. This includes administering enoxaparin as prescribed, applying STDs, encouraging active range of motion exercises every 2 to 4 hours, assisting the patient with ambulation as tolerated, PTOT, encourage adequate fluid intake, and the third priority is for prevention and safe mobility. The patient has a Hector Davis fall risk score of 28. This is a high fall risk, and intervention includes non-skid socks, assisting ambulation using a walker and a gait belt, keeping call lights within reach, maintaining clear walking path, and performing frequent safety rounding. In terms of discharge planning, the patient's spouse has requested home health services, and case management is currently discussing this possibility of acute rehab or skilled nursing facility placement to support recovery. Before discharge, the patient will require education on incision care, medication adherence, management of diabetes, safe ambulation techniques, and follow-up care with a healthcare provider. That's all with the patient situation, background assessment, and recommendation report on the bedside for my patient. Thank you.